Hey, how you doing today? Dr. Mabanta. I went to a patient's room the other day and she asked me, why? I just noticed you were adjusting a child in the other room. Why would you ever adjust children for chiropractic care? Do they have spinal problems? And so what I told her was that the purpose of adjusting children is the same as it is for adjusting anybody. The goal is to remove as much pressure and interference to the nervous system as possible so that the body can control, coordinate, and organize itself through the central nervous system. The question is how can children have pressure and interference to the nervous system at such an early age? And when you think about it and you look at the things that children go through early in life, you can kind of get an understanding of how and why there would be misalignment of the vertebral column and pressure on the nervous system. One of the first things that happen with children is they go through the birthing process. So if you think of modern obstetrical birthing techniques, the things that they do are sometimes contrary to the natural birthing of the child and it creates some undue and abnormal stress on the infant and on the mother. So one of the things that occurs is the position that the mother is in, laying on her back with the pelvis slightly tilted up. Works great for the obstetrician so they can see and monitor all the things that are occurring. However, the mother is now on her back, her pelvis and her sacrum have a difficulty in tilting backwards, allowing that pelvic and birthing canal to open up. In addition to that, the mother is laying in a supine position on her back, so she has to push along the perpendicular plane of gravity, opposed to being in an upright position or an alternate position. And if you look in other cultures, sometimes in third world nations, some of the birthing processes are actually easier because they utilize gravity for the mother's position. Different positions are utilized which allow that baby to be extruded through the birthing canal without having the obstetrician apply pressure and tension on the baby's neck. If you ever watch a modern birth in a hospital setting, they'll often pull the baby's head as it's coming out to pop one shoulder out, and then they'll pull the baby's head in the other direction to pop the other shoulder out, and then the baby will usually release quickly after that. But that amount of pressure is significant, and that's where some of the first vertebral subluxations can occur. In the upper cervical spine, that pressure and tension that they put on that infant can cause some irritation. Now, it may not show up in terms of abnormal positioning or even distorted posture or movement. However, the pressure in the upper neck area can cause irritation to the transition from the brain to the spinal cord. In addition to the birthing process, children, if you watch them develop, they're going through different minor traumas. A toddler, when it's beginning to walk, will fall several times on the bottom, on the sacrum, impacting the force. As a child grows, it's experiencing forces and traumas that it's experienced through normal daily activity, through playing with siblings, with friends. So those forces exerted on the children can cause the misalignment in the vertebral subluxation. By correcting that, you enhance the brain's ability to control, coordinate, and organize the function of all the systems of the body. So one of the things we see with children is the immune system improves. Things like chronic ear infections clear up, bronchitis, asthma, digestive disorders. Does chiropractic treat any of those diseases? No, not really. What it does is it takes pressure off the nervous system, allows the brain to communicate freely to the body, and control and coordinate and organize it in a higher manner, and as a result, the health is enhanced in the children. Children also are adjusted differently than adults are. The way that we adjust them requires very little force because the mobility is much greater. The size, obviously, of the vertebra and of the children is different. So different techniques have to be utilized for children. But can they get adjusted? Yes, absolutely. They can get adjusted from day one till the remainder of their life. So that's what happens with children. Yes, they get chiropractic care. yes, it's very good for them, and we encourage you to have your children checked on a regular basis to make sure that they're developing healthy and happy. Thanks so much. I'll talk to you later.